just wanted to do a quick announcements or information to the members that are present.
Well, the idea for today was when asked what items to place on the agenda was primarily concerning how the COVID pandemic is affecting individuals who have disabilities. And so I had read somewhere where many of them have underlying conditions, and just like the rest of us who hesitate about reaching out to seek out medical help, or we're delaying things because of the issues of negative effects of the COVID. I thought that we could discuss that, because I know that we all provide different services to different individuals with different disabilities, and so I just wanted to see if the group had any specific issues, problems or conflicts that were surfacing, and we might discuss those and address them if we could, as a committee, address them with the city or other agency that might be able to provide more insight or more help. So that was the whole idea behind the 2 agenda items for today. So yeah, it does require that people be here so that we can see how their different subgroups of people that they do serve have been affected by the pandemic. And so that was the whole idea. Dr. Ruthinger, I don't know if you have any other.
I have a couple. The first thing was looking back to our meeting, previous meeting, and I remember that they talked about that there were gift cards valued at $100 each to help families during this time of need. It said something about that they can then explain their program via phone and schedule for them to pick up a gift card at the health department. We had mentioned that as a group, we would like to have some kind of like a little info sheet or something sent out to each member. I know that I didn't get one. I don't know if y'all got one. Maybe I was just not paying attention and got an email. Did you all get an email?
I will follow up. So Christine Reyes, who's part of that special needs program in the health department.
And then I can't get it to unmute. So I don't know what's going on.
I thought he was saying something. So Christine Reyes just connected. She's part of that program for the health department. I know they've been working on other projects at the moment. I know the gift card project was successful. They were distributing those out, but I think it is a good idea for them to do some sort of flyer or information sheet for the committee.
And just general information, Erica, if it's possible. I know that they mentioned that 20 clients had received help, but it would be good for us to know in case anybody, asks us, we can tell them just general information, who to call or how to get help.
Okay. I'll follow up with staff so that they give you a quick info sheet on
just contact people, purpose of the program, that kind of thing. Just real general.
Mm-hmm.
Hello.
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 This is Roberto Delgado.
Yay.
Hello,
Hi, Mr. Delgado.
Hello.
Mr. Delgado, good morning. How are you, sir?
Fine. How's everybody?
Mr. Delgado. Bien, ¿y usted?
Oh, bien, gracias a Dios.
That's good.
we need one more member and we'll have quorum. So yes, I'll get with staff from the health department to do a general information sheet on contact information and purpose of the program so that the committee can have that readily available and disseminate, amongst their contacts. So
Thank you.
We'll do that. I know they've been working on other projects, as I mentioned. For September, it's Childhood Cancer Awareness Month. And I know they were doing a couple of projects there. They will have a proclamation with the mayor. They're also working on in October for a virtual job fair. So they'll be connected with that. I know some of the members here. Ms. Sanchez, I don't know if you have any information. Oh, is she still? Yeah, she's still connected. So I know they'll be working on those efforts. And really, I also wanted to let the committee know we will be launching a new project for veterans' mental health, which, in some particular cases, does involve the demographic of people with disabilities and, of course, our veterans. This is a project that we applied for in conjunction with our community development division of the city of Laredo, and we were granted this project. So we will have a health educator to assist with providing information on mental health resources, particularly for veterans, and we think that's very important. And of course, our purpose with any of our projects is tying people in, bringing them in, giving them access to care, and then providing any referrals to subsequent services that may be needed. So we're very excited about that.
Erica, that sounds great. I have a question. You mentioned veterans with disabilities could gain access. Can all veterans gain access should they have an issue?
Yes, it's all veterans.
Okay.
It's for mental health.
So you don't have to necessarily be criteria where you're a veteran with a disability, just be a veteran and gain access?
Correct.
Great. What's the name of the grant called?
We were granted through, let me, through the Fund for Veterans Assistance. So that's who we were granted by TVC grants from the Texas Veterans Commission. And there's a component for mental health that the health department will take the lead on. And then there's another component for, I believe it's housing through our community development division.
Sounds great.
So, and they'll also, like I said, this will focus on mental health. So we will connect them also offering, I believe, like Tai Chi classes,
Oh, wow.
things like that. So trying to incorporate like just a holistic like well-being. Okay, so Ms. Ada will try to connect. Ms. San Miguel won't be able to join us.
And I believe is still in a meeting. Can you hear me?
Mm-hmm.
Yeah. So I don't believe she's going to join us.
Who is? I'm sorry?
Ms. Ramos, Jeanette Ramos.
Oh, okay.
Regarding this program for the veterans, we also serve veterans. So see how we could partner and form some type of bridge of collaboration, because we do have actual caseworker who his focus is to work with veterans. So that'd be great.
So that actually gives me a great idea, Ms. Sanchez. We will have vacancy for a health educator position that's going to lead this grant. That should be posted sometime this week. So through workforce, contacts, if you know of any veterans that might be interested, I think this would be something. I know the city of Laredo does provide, we have the policy in place to at least offer a veteran an interview. And it would be, I think, a plus if we get someone.
Yes, that's a great point. You know what? I'll reach out to the veteran from the TVC who's housed with the Workforce Center, Gabriel Lopez, to reach out to. Should I have him reach out to you?
Sure, I have information on the position.
Yeah, I'll let him know that we had the conversation, and I'm sure because his role is that's what he does. He's assisting those veterans who are job ready, seeking employment. So I'm sure he's got a good pool of folks there. But I'll surely reach out to him and have him connect with you.
Perfect.
And it's an educator position. That's the okay.
A health educator position, so they would pretty much connect veterans and with, services available.
Okay. Will do. I don't know if this is the time, but I do want to share that TWC has invested in a virtual platform. So due to these days that we're living in, we will be hosting our 7th but first virtual job fair. We're still going through the strategic planning. I believe we're going to do youth. I don't know if we're going to include adults, but of course these are youth with disabilities on our caseload. And that is scheduled tentatively for October 22nd from 9 to 1. And I will be reaching out to ODA to see how we can partner so you all will have at least informational booth. But it's a really amazing platform. We'll have training. Everybody will be on board before we actually do this because of the nature of the beast. We're going to wrap our arms around this platform. But it's an amazing platform. I understand it's very expensive. So we're blessed to be able to have this platform to help our folks seek employment. I just wanted to put that in there.
Okay. It looks like Ms. Adriana Aro just joined the meeting. So
Okay.
at this point, the committee officially has quorum.
All right.
Okay. Maybe we can start. Okay, well, welcome all of you to the meeting of today, which is August 26th, 2020. And first thing on them is first item is for us to go ahead and review the minutes for the last meeting and see if there are any changes, revisions, or changes that we need to make. Corrections.
Tony, mayor, ¿cómo siempre? ¿Ya pensaste por qué van a ir?
I'm trying to share them on the screen for those that,
Okay. Good.
but I believe they look kind of small. Let's see.
Porque ahora no va. Bueno. Se canceló ya a las 10 de la mañana. ¿Habló por cancelar? Era a las 10 de la mañana.
One, two, three.
Okay, for those that are on the video WebEx, I have shared the minutes on the screen.
Okay, thank you.
Thank you. I make a motion to pass the minutes.
Was
Do I
that
hear a
Ms.
second?
Who made a motion to approve the minutes?
Yes,
I did.
Masato?
Yes.
Did anyone second that?
I'll second it. Yana
Okay,
Sanchez.
thank you then. Thank you, Diana. Okay, let me, including that, then can I move on to the public comments? Did anyone sign up for public comments or anyone have comments to make?
We don't have any registered public comments at this time, Mr. Chair.
Okay, thank you. Okay, so I guess we can move on to the following item. The agenda is regarding discussion, possible action, how people with disabilities have been affected by COVID-19. And of course, in relation to this, prior to everyone being on the line, the idea was if we have been affected, then I would assume individuals who have disabilities and are less mobile than we are probably even more so affected. So I don't know if there's anything that you all want to share about how the pandemic has negatively affected the individuals that you are currently serving.
Well, I think what was brought up about the job fair is certainly one way that, the standard operating procedure has changed.
Yeah, that's a good observation. This is Dr. Ruthinger.
I don't know if any of the other members have anything to share regarding, their experiences, with their employment or, access to services at this time. Like Mr. Castillon has said, it's been a challenging time for all of us. So more so probably for, people with disabilities that might need any additional assistance. So this would also be a great platform to share any services that are available to remediate that.
Are any of the agencies that are represented doing anything beyond just what they typically were doing in the past in order to alleviate or address the COVID-19 effects on individuals with disabilities?
Well, as for us, the virtual platform it's been challenging, because we are individuals who want to touch, hug, and shake hands, and that has been a challenge for not only the customer, but for us, in the nature of work that we are, in the line of work that we are, it's been difficult. And Ceci, I'm sure, can chime in, her being, a ESP, it's been very challenging, but we are blessed to have the technology we have now. Imagine this pandemic prior to this technology, we'd have been out of luck, I think.
If I can add a little bit to that, Diana is correct. We have had a change in the way we conduct our classes and the way we seek employment. The focus more than anything else is on making sure, because we do work with individuals who might have sensory issues, for example, wearing a mask, making sure that we educate them regarding distancing, social distancing, regarding wearing masks, regarding not touching their faces. All those things are elements that we have to look into, and making sure that when we do place someone to work, we can receive accommodations or provide accommodations to meet their needs. Because if we don't, then we are adding to the problem and not taking away from it. Okay. So it's been a challenge, but nothing that we can accomplish if we use wisdom and we follow the guidelines set forth by the CDC.
Mm-hmm.
Thank you for your comments. Thank you. I would assume that one of the things that happens most commonly is that if you have clients who come in regularly, like those afflicted by or challenges with their eyesight or even mental health, I would assume that it's become more difficult for them to get to the location to receive services, and then most of them may not have the technology either or do not know how to use it. And so that may be an issue as well. I know that we can do everything mostly by phone or by video chat. That helps a lot. But I think that those would be issues. Ms. San Miguel is not on the call, is she?
No.
Well, the idea here was that we would have an opportunity to identify some of the challenges that the pandemic has created, and then if there, as an agent, as a committee, if there's anything that we can address with the various agencies or even with the city of Laredo as to how we can alleviate some of the negative outcomes of the pandemic on individuals with disabilities.
Mr. Chair, maybe that's where what we should review, maybe start from there. What has the city of Laredo done in regards to the COVID virus? Just generally speaking, the decisions that they have made that affect the entire community. The regulation regarding, if there is a need to stay indoors, the policy that has been put out for the entire community. Can we review that?
Sure, we could identify what is it that the city has done or is promoting. I see the mayor frequently on doing public announcements.
So the city does have, they do have media briefings every Monday, Wednesdays, and Fridays at noon. These are streamed also live via Facebook, and then all of the media outlets pick that up with pertinent information where they discuss the current statistics, the numbers of incidents for COVID, any updates on additional mandates or upholding. Police provides the feedback on any type of citations that were issued. Of course, City of Laredo always abides by the guidance of Governor Abbott. I know there was some back and forth there early on about the mask mandate. I know that there's also some questions on the curfew, on how the restaurants operate. In terms
Where
of
are we on that? I noticed that for a while, people could not be seated in a restaurant. It was all, pickup service. But then I noticed where, because of the statistics, it was okay to attend, but there was a limit as to how many people could be in the restaurant. Where are we on that?
I believe at this point they are doing limited capacity. Some restaurants are able to do dine-in service. This is monitored not only by the police department, but by our inspectors, our sanitarians. Anyone that has a concern, any constituent can address that or report it to either 311 or the police department has an app now where people can anonymously provide a report or a complaint, and they follow through with that through there. So,
where's the main? Where's the health department sending most of the people that want to be tested for COVID? I don't know that. Is it one specific place that got the contract, or is there a place?
So there are several private laboratories in Laredo that provide the test. We do have a listing of resources that I can share with the committee. The health department did compile that information and dispersed it to the general public, and that's the information we're provided to callers. The health department does offer testing for symptomatic or those that are that have been exposed, so that are part of an investigation. We do provide testing for that. We do have a screening hotline that, or an appointment hotline that if you meet those requirements, of course, they ask you some questions, and then they set up an appointment for testing. That line is 795-4932. And that's where they can call the health department. If for whatever reason the health department cannot accommodate at that time, they're provided other resources. I know the county has also periodically provided free testing at the Lansdowne Fairgrounds. And then the city also works together with the Guard, providing testing at the Sames Arena. So I'm not sure if that's going to pick up anytime soon, but I believe this week are doing free testing at the Live Fairgrounds.
Thank you, Erica. And I had heard at the beginning, I may be wrong, correct me if I'm wrong, I had heard at the beginning that Quest Diagnostics had gotten a grant to do the testing for Laredo. Is that true?
I wouldn't be able, I do not have information on that. I know Quest does run some of the tests. I know there's another, like I said, there are other laboratories that have that capacity. We do, the city of Laredo as a whole does have a contract with Quest just overall for lab testing. I will say though, however, we also do the testing in-house. So the city of Laredo Health Department is equipped with a BSL level 3 lab, and we're able to run testing for COVID in-house.
So then there are, just to review, there are several locations in Laredo where people can get tested as long as they meet the criteria?
Yes, so I can go ahead and share with the committee. Like I said, there is a resource, like an information sheet that was compiled and sent out on the different sites. Any type of pricing, if there's price involved, any type of requirements that need to be met to be tested. It's a little infographic. I'll go ahead and email it to you guys shortly.
Thank you so much. Daniela was bringing up that how does it affect people with disabilities, or speaking from my part, since technically I'm elderly now, which I think about my own health and the avals that we all get, the screenings, just the screenings that we all usually get. Most of us are not doing them. Most of us are waiting. So I would think that is one way that everyone is being affected. You don't go in to do just your screeners that you normally would do. Oh my goodness. He's so beautiful. Look at him. I'm sorry. He's so, oh my. Erica, he's so beautiful.
Yo.
The youngest member. The youngest member of our committee.
Yes.
Awesome.
He wants to provide some feedback also. Yes, there is apprehension in our community regarding going for routine, right, or preventive health appointments. And I know even at some point physicians had, closed their office or had additional restrictions set forth. I know if you were considered low risk, you were rescheduled. That happened to me personally as well. So COVID did impact, but I think we continue to hear the media briefings where we hear the health authority, Dr. Victor Trevino, he keeps emphasizing a new normal, right, where we have to make that additional consideration of precautions, of wearing a mask, of social distancing, of staying within our family unit, trying not to, like Ms. Sanchez mentioned earlier, we're a type of community that we treat by, a hug and a kiss and want to be close to one another, but for the sake of our safety and health, we
cannot do that right now. Yes.
So I'll go ahead and share the resources that are available in terms of testing. I could also send you all out, and it's, I know you were asking, like, where do we stand? I can send you out the last mayor's order that was executed. I know it's been some time now. I know there's also been questions on establishments that are open, like the Maquinitas and other venues like that. So that details any restrictions there. And I'll go ahead and send you that updated ordinance so that the committee can review.
Thank you.
I will say though, health department remains operational. So if there's any person that requires any type of resource at this point, we do have our medical clinics that are still taking patients, seeing patients. We have our partnership with UT Dental that are still, providing dental services. We have our WIC program. I mean, all our services, they might have some sort of adjustment in their operation, but we're still open for business.
Good.
I did want to make a comment, Mr. Chair. I know, like I said, Christine Reyes from our Special Needs Project for the Health Department is in the call. Ms. Oda was not able to join us today, but I would request or suggest that they have a standing maybe item on the agenda to provide updates every month to the committee on their projects, their upcoming projects. I briefly mentioned them right now. Like I said, for September, they're focusing on childhood cancer. In October, they're working with the virtual job fair for people with disabilities. And they would, of course, have more information regarding the projects that they're seeing, and then any information that the committee needs, they'll be able to respond to. So moving forward, we, like I said, we can have them as a standing item on the agenda if you permit.
Sure, absolutely, yes, we can. I appreciate that. We could put them on the agenda from now on, so that they can provide us with ongoing information of the progress of their projects. And yes, I would appreciate that so much.
Sure. Chris, I don't know if you have anything to add. Okay.
Mr. Chair, I say something?
Yes. Who's
I'm
this?
sorry, I'm at work with the census, and my phone is very low. I'm gonna have to leave you guys.
Okay.
Is that okay? You have
No,
it?
Okay. Thank you, Masato, for joining us. It's great to hear from you.
Bye,
Stay safe.
Masato.
Likewise, thank
Bye,
you.
Adriana.
We'll talk to you soon.
So did we lose our quorum now?
Yes, but you were able to cover, I believe, the points on the agenda and
Yeah.
go over. So
Yeah, we're pretty much done with the meeting. Any other comments or concerns that any of the members might have regarding COVID-19, how it affects the population that we serve? I know that this is confidential, Erica, but is there any way does the city keep track of any subpopulations that are being infected by COVID or dying from it? So I know that sometimes people, when they announce who's passed away, they'll say 65-year-old man who had underlying conditions passed away, wherever location. But do we know if the COVID disease is infecting or afflicting individuals with disabilities more so at a greater percentage than the typical individual?
I know the general information that has been provided is that, of course, we do see complications or mortality on those that do have underlying conditions. Of course, we're a community that has a high incidence of diabetes and hypertension. Those are very common in those complicated cases that we see. Of course, the health department is a repository of all that information. So all the data that's acquired is shared in a comprehensive way. Of course, we don't go into details on names or any particulars, but there is a breakdown of, age ranges, whether they're more male or female. I think they're even broken down by zip code in our community. There is a great website available. Let me see if I can find the link for you.
Okay.
It should be connected through our City of Laredo website, but that's where, like I said, there's a lot of good information as to the incidents or what the outlook is in our community due to COVID-19.
If I can add something, both my husband and I are doing contact tracing during COVID. And one of the things that he does one portion of it, I do the social aspect of it. One of the things that's happened is with the individuals that I touch base, because I don't work in the Laredo area, I do all the outskirts, little towns basically. And individuals with special needs have not really popped up because parents have protected them and they keep them home. So that's not occurring. But those cases that we have occurred are usually the individuals are asymptomatic. They show no symptoms whatsoever. I call it God's grace and mercy because it's kept them from, and I'm talking about the younger group, not necessarily people with diabetes, but the more severe. And they have no symptoms whatsoever. So it's very interesting to see that the statistics and everything. Most of them of the cases that have come up have been individuals who don't even realize that they have COVID, and they're walking around, and that's how they end up. Out of curiosity, they go take a test, and that's how they find out they're positive. But in my area, and I've outreached probably at least 1,500 people, and out of that group, I've only had 2 individuals that have told me, this individual had a disability, and they're under age of 24 and under.
So how are you reaching these individuals? Are you doing tracing, or is it just part of the census,
No,
or what are you doing?
it's COVID tracing. Okay, I contract with an organization, another entity, and basically what happens is we call up and ask them how are they doing. What symptoms do you have? The state is just basically gathering data. Do you need any resources? If you need resources, for example, I had a person in a town who was evicted out of their home. They had 3 children out of the 5 had contracted COVID, including the mother, and they were evicted. So my job was to make sure that they found a place to stay. Food was available, thermometers were available. But like I said, from the list, mind you, and I'm just one individual out of over 1,500 cases that I've seen. I've only seen 2 individuals with special needs that have been told, you're positive. And even those 2 individuals had no symptoms whatsoever.
So the impression you have is that individuals with disabilities are being very well protected.
I think that the element now, for those of us who walk and might have diabetes, high blood pressure, comorbidities, that's an option. But the ones that have more severe, your Down syndrome, your autistic parents are actually, even in my area here where we do placements, a lot of my parents and customers who have disabilities have chosen not to engage until a vaccine is available. So I think it's a protection that the family is taking, and across the board.
Thank you for the information. Quite interesting. So, Erica, you did mention that there's a link or an area in the City of Laredo website that provides more additional information, insight into location and identify the demographics of those individuals.
Put it in the chat here. If not, I'll email you after this meeting the link. But okay, I know that, like I said, a comprehensive view of the demographics and specifics of what COVID's affecting. I will have to also echo what Ms. Ceci is saying. Just in a conversation with Ola yesterday, I know they were reaching out to families that were, affected by childhood cancer, and trying to see how we incorporate, any type of outreach events for highlighting it for next month. And the parents all, resonated that they did not want to expose their children. They didn't want to go out anywhere. So yeah, anyone that sees any type of underlying condition, I do think they're being additionally cautious with COVID. So, but feel free to reach out, Ms. Ceci. I know, yes, Mr. Gutierrez is working with our contact tracing staff, but if there's any particular cases, I know our community development also has resources for housing for anyone that's been displaced. I know the City of Laredo as a whole is looking for any type of innovative ways to care for our community and get them through this difficult time. Many people see, they lose their jobs. I know they were trying to do some sort of relief for utilities. That program's still there, but you did have to enroll. I know they've been seeking out with the restaurants closing. They're doing a fund to provide some relief there for small businesses in our community. So there are also efforts out there, and especially if there's a family affected that does have a person with disabilities, we want to make sure that they're connected to the correct resources.
Thank you for the information, Erica. Anyone have any other comments to make?
Oh, and another thing, and I'll share that information as well, with the start of remote learning. I know that some households might be stressed about not having Wi-Fi connectivity or the appropriate, bandwidth for that. The city did implement citywide general Wi-Fi spots, and there is a link that provides where those are available. So I'll share that with the committee as well. So I'll just do like an overall email to the committee after our meeting, providing where to get tested, where to get the information on, and on the demographics, who's affected by COVID, and the link to the free Wi-Fi and any other resources that are available.
Okay,
Thank you so much, Erica.
Yes, I do see Ms. Rebecca Morales has connected with us. So, Mr. Chair, there's quorum again for the committee. I don't know if there was anything else to share.
I don't have anything else. Rebecca, thank you for joining us. Hello.
Oh, I'm so sorry. I was stuck in interviews and I just finished. So I said, let me see if they're still there. I really apologize, but we were called in since the morning. So
Thank you for being with us, Becky.
thank you.
So if no one has any other information, can we close the meeting? And if so, I need someone to motion for that.
I'll motion.
Okay.
I'll second. This is Georgia.
Thank you. Before we depart, I guess the next meeting would be scheduled for September 16th, which is the third Wednesday of in September.
Yes, Mr. Chair. So I did do the link as a recurring meeting through WebEx, so it should be the same information. I will double check that for the setup for the WebEx meeting so that you guys have the same dial-in information all the time. But I did put it as a recurring event for every third Wednesday at 11. And we'll follow through with you guys for whatever you want included on the agenda for next month. But as previously mentioned, we'll go ahead and put an item for our special needs project to provide you an update at that time.
Thank you.
Okay.
Thank you.
Thank you, Erica. So I know that someone had motion, someone had seconds already, right?
Yes.
Ms. Sanchez
Okay.
motioned, Ruth Inger seconded.
Okay, so then I would recommend that we adjourn the meeting at this time, and thank you all for being here. I know it's kind of challenging and difficult. It takes more effort, and been hopping on a car and just going over. It makes it much easier, but we're having some technical issues. Okay, not all of us are as savvy as others. Okay, so and I include myself in the negative level of that one. So I didn't. It wasn't meant for anyone but for myself.
No, it's just the nature of it. Even I have, glitches, and it's just the nature of technology. Hopefully soon enough, we'll be back together, able to meet in person. That's the hope, I think, for all of us.
Yes, absolutely. You all stay healthy.
Okay.
Thank you so much.
Y'all be careful, wear your masks.
Bye-bye.
Yes. Okay. Bye.
Bye-bye. Thank you all. Bye-bye. Thank you, Erica.
Thank
Thank you,
you.
Erica.